And then the impairment of aging and illness, we're going to talk a little bit about that as well. The reason we must deal with it, and this is kind of duh, but is to ensure good patient care. You can't, if you've got a bad relationship with a nurse or tech or another physician or administration, it's difficult to get to the level of care you need to do. And I'm going to give you some examples. I'm going to change up names and places so that I protect the innocent, but I'm going to give you some examples of that. Number two, which is really high on the list, to evaluate signals of impairment in physicians and nurses, because if we have someone that's been stellar and has been a really good communicator, a good physician, good outcomes, and all of a sudden something changes, either in his behavior, his rounding, his notes, his appearance, then that's a sign. That's a sign that something has changed, and I'll go into that. It could be substance, it could be depression, it could be burnout, it could be a divorce, it could be lots of things. So that's our place to help, to get in a position where we could help. And then access a process that is not working. I came up with this, I call it my gestalt of peer review several years ago, and you've seen it before to some degree, is that physicians, we think we work in a vacuum, we don't. Nursing staff certainly thinks they work in a vacuum, but they don't. Depends on if they're in ICU or emergency room, they really think they do. But we all work with hospital processes. We all work right in the middle. And what we see with a physician that's had disruptive behavior, he is reacting to the nurse or the tech, doing something he doesn't want her to do, or she's trying to get him to do something that he wants her to do. And they're following the process that the hospital and you guys put in place. So 90% of the time, disruptive behavior can be traced to a hospital process that's not working for you. And so what we're trying to do, it needs to be a two-way street. You don't go in and try to address poor behavior without addressing this at the same time. Same way with the nurse. I mean, it's a three-legged stool, and you can't work one without doing the other. Otherwise, it's punitive and it's not helpful. And so what you try to get out of all these conversations is, okay, what can we do to help you so you don't get angry, so you do get what you want? At the same time, you can't do that. You can't scream and throw at things, and so you change the process. That's the way it's supposed to work. Communication is the Rosetta Stone of disruptive behavior. One, you have to define what it is. If you don't define it, then you don't know what it is. I've had physicians tell me that the F word is inappropriate and it's not profanity. So you have to define that. You have to say, well, yeah, that is. And I've got one friend that practices in Green Bay, Wisconsin, and he said, well, that's not considered profanity above the Mason-Dixon line. So you kind of have to define your realms. And then the other part of communication is communication between each other. I mean, that's raising children, that's being married for a long time. That's just what we do every day. If you think you hate change, you're really going to hate being irrelevant. We're about to see unbelievable amount of change in healthcare, as you know. If this national health care bill continues to fruition, we're going to see changes like we've never seen before. And they're not all going to be good. I happened to be on a program in Cape Cod a couple of months ago, and the lawyer for the Massachusetts Hospital Association spoke after me, or before me, on one of the days. And he gave a synopsis of the Massachusetts healthcare law, which is kind of what this new law is patterned after. And he went over all the stuff from Stark laws to global payments to all this stuff. And then at every other word he said, but we don't know how we're going to pay for it. But we don't know how we're going to pay for it. He said that about 12 times. But if half the stuff on his slides actually happened, I think most of you that have gray hair in here will just quit, because I mean it was pretty tough stuff. So we're about to see change in a big time. Y'all have your electronic medical record here yet? You have? Okay. We developed ours at HEB and it rolled out in March, and we had some people actually quit the staff. They said, I'm too old for this. This is too tough for me to learn. I'm out of here. And they were ready to leave anyway. But where it changes is here. This is, to my generation of physician, the golden age of medicine, where physicians were accountable to no one but Asclepius, the Greek god of medicine and healing, is a thing of the past.